Okay, let's dive right into this explainer and uncover the hidden variables that actually affect how older adults recover after surgery. If you've ever cared for an aging parent, or honestly, if you're over 50 yourself and prepping for a procedure, this is information you absolutely need to have in your back pocket.
So I want you to ask yourself a question. Why do some older adults bounce back from an operation seemingly overnight, while others face, well, really unexpected confusion, sudden memory problems, or just lingering complications for weeks afterward? It's a stark contrast, right? And the answer actually isn't always related to the procedure they just went through.
You see, a lot of people think the surgery itself is the biggest or even the only risk, but in a lot of cases, the real hidden variable is actually the anesthesia. It can create challenges that seniors and their families simply never saw coming. So today, we're going to pull back the curtain on the whole shebang.
Here's our roadmap for this explainer. We'll start with number 1, the hidden surgical risk. Then 2, aging and anesthesia. 3, confusion and delirium. 4, memory and fall hazards. And finally, number 5, steps to lower risks.
Let's kick things off with Section 1, the hidden surgical risk.
Now, don't get me wrong, anesthesia is, without a doubt, one of the greatest advances in modern medicine. I mean, it's a literal medical marvel that allows surgeons to perform life-saving procedures without us feeling a thing. Millions of people receive it safely every single year. But we have to frame it correctly. For patients over 50, and definitely for their caregivers, anesthesia is an unseen variable that requires some really specific preparation.
Moving on to Section 2, aging and anesthesia. So, a 35-year-old body and a 75-year-old body do not process things the same way. I mean, anyone with a creaky knee can tell you that for sure. But what most people don't realize is that the exact same dose of medication impacts a younger patient very, very differently than a senior. It all really comes down to how medication is absorbed, distributed, and eventually removed from your system.
The absolutely crucial point here is that as we get older, our specific organs, our brain, heart, lungs, liver, and kidneys, they gradually lose some of their efficiency. They just don't work the exact same way they did 3 or 4 decades ago. And because these are the very organs that process the anesthesia, a slower system means the medication lingers differently. That's what causes effects that are completely unique to aging bodies.
All right, Section 3, confusion and delirium.
Temporary confusion is one of the most common post-operative concerns. Imagine a grandfather who goes into the hospital for just a routine knee procedure. He wakes up and suddenly he can't remember why he's in a hospital bed, he's unusually sleepy, or maybe he doesn't immediately recognize his own daughter. That is incredibly frightening for a family. They immediately worry something catastrophic has happened. But in so many cases, this is temporary confusion that improves within days. It simply highlights how deeply sensitive the aging brain is to these medications. Then we have a clinical condition known as delirium. Now, this is a sudden, sharp change in thinking and awareness after surgery. A patient with delirium might become highly restless, or actually the complete opposite, unusually quiet and withdrawn. It appears suddenly, and it is completely valid that this scares families. Clinically speaking, though, the risk of delirium tends to be much higher in patients who already have existing memory problems, hearing loss, poor vision, or multiple medical conditions.
But here's the really surprising part you need to know. Anesthesia isn't the only culprit here. The post-operative environment is kind of a perfect storm. Lack of sleep in a super noisy hospital, uncontrolled pain, hidden infections, dehydration, and even interactions with other medications. All of those can trigger this exact same confusion.
Let's move to Section 4, memory and fall hazards.
This right here is a massive warning for caregivers. Older adults may remain drowsy or unsteady much longer than younger patients. A senior might be sitting in their favorite living room chair, feeling perfectly fine, totally conversational. But upon standing up quickly, boom, that lingering unsteadiness hits. They become dizzy, and they suffer a really dangerous fall. So many post-surgery injuries happen simply because patients completely underestimate how long this unsteadiness lasts. Having at-home support in those first few days is absolutely vital.
Now, I want to provide a really strong reassurance anchor right here. Many seniors have this deep, deep anxiety that anesthesia will permanently damage their memory. But current evidence suggests that permanent memory loss is not directly caused by anesthesia. Cognitive dips, like having trouble concentrating or paying attention, are just a temporary part of the healing process. Recovery is a journey. It's not an overnight event. The body just needs time to heal.
Okay, bringing us to Section 5, steps to lower risks.
A lot of seniors focus entirely on the surgeon and the operation itself, and they never actually sit down and discuss the anesthesia with their doctor beforehand. Let me be clear, age alone should never stop someone from getting a beneficial surgery, but you absolutely must discuss this specific medical history. Things like heart disease, lung disease, diabetes, sleep apnea, previous reactions, or even common over-the-counter supplements, they drastically influence how your body reacts. Giving your medical team this info allows them to customize their techniques and adjust doses specifically for you.
So, here is your empowering 5-step checklist to lower your risks. 1. Be completely honest with your medical team about your health history. 2. Ask questions. What type of anesthesia is being used? 3. Stay healthy before the surgery by eating well and staying active. 4. Bring a trusted friend or family member to appointments. They can help advocate for you and remember instructions. And 5. Follow all recovery instructions carefully, particularly regarding proper hydration and medication.
This quote pretty much perfectly summarizes our core thesis today. The vast majority of older adults undergo anesthesia safely and recover wonderfully. Proper planning and open communication with your healthcare professionals doesn't create anxiety, it leads to safer decisions, tailored care, and ultimately, just much better outcomes.
Before we wrap up, I do need to briefly state our standard medical disclaimer. The information in this explainer is for educational purposes only and does not substitute for professional medical advice. Always consult your healthcare provider before making any changes to your care plan.
And finally, I want to leave you with this provocative thought. Have you, or maybe a loved one, ever experienced anesthesia during surgery, especially later in life? What was the recovery actually like for you? We'd love for you to share your own experiences or questions in the comments below. If you found this explainer helpful, make sure to subscribe for more structured health insights. Thank you so much for learning with us today. Stay informed and stay proactive.